with Sam Seder.
The destiny of America is always safer in the hands of the people than in the conference rooms of any elite.
Sam Seder.
They are unanimous in their hate for me, and I welcome their hatred.
We must guard against the acquisition of unwarranted influence, whether sought or unsought, by the military-industrial complex.
The Majority Report with Sam Seder.
Ever get the feeling you've been cheated?
It is Monday, April 12th, 2021. My name is Sam Seder. This is the five-time award-winning Majority Report. We are broadcasting live steps from the industrially ravaged Gowanus Canal in the heartland of America, downtown Brooklyn, USA. On the program today, professor of history at the University of Chicago, author of The Next Shift, The Fall of Industry and the Rise of Healthcare in Rust Belt America, Gabe Winant will be here. Meanwhile, COVID continues to surge various places across the country, particularly in Michigan. And now we have competing stories over vaccine supply. Meanwhile, Iran nuclear site hit by alleged Israeli sabotage happening, aimed at perhaps scuttling or complicating U.S. negotiations with Iran. Joe Biden picks a Trump critic to head the Customs and Border Patrol. Good news, according to activists. However, Biden's set to accept the fewest number of refugees ever, while everyone awaits a signed presidential determination to put in place what he claimed he was ordering weeks ago. Battle emerges between Pelosi in the House and Sanders in the Senate over whether to double down on the ACA or expand Medicare. Hunger strikes hit day 13 over U.S. participation in the Yemen conflict. And amidst the Chauvin trial, another unarmed black man killed outside of Minneapolis. Lastly, congratulations, CEOs. Your pay surged in 2020. Everyone else's, not so much. All this and more on today's Majority Report. Welcome, ladies and gentlemen. Thanks for joining us. Joining me, as always, she is back from her convalescence. Emma Vigeland. Emma, good to see you.
I didn't watch the show. I'm sorry. I was not feeling well on Friday. Did you mention why I was not feeling well?
To be honest with you, I can't remember.
Okay.
I think,
I
feel
had some vaccine side effects. It's okay. I wasn't sure if I even wanted to share that because I don't want to discourage anybody, but it was well worth it. I will say.
Yeah, a lot of people have, don't feel so great on day, particularly after the day 2 shot, and that lasts, 24 hours, 36 hours in some cases, and so much better than getting COVID.
Right, exactly. And so now, I mean, as it was my second shot, in 14-ish days, or now I guess around 10 days, I'll be fully protected or mostly protected, and that's an incredibly freeing feeling. I must say.
Yeah. And it's, these side effects are, like I say, they're well known and not long-term. And so, small price to pay. Sometimes you get a flu shot, you get, you get a little red and swelling and maybe a little soreness. And this is a little bit more than that. And that's the soreness anyways. And
okay. Yeah.
Some people get like a little bit of a fever, but again, it is your body essentially training itself to react in many respects and practicing reacting to the potential of COVID coming by.
I remember the chickenpox vaccine. My brother got it, and he literally got minor chickenpox.
Is that right?
Yeah, it's like, what's the point? You still get it, but it's a much milder case. I do see the point.
Right.
Right.
And I don't think this is not akin to getting COVID. This is a reaction. Your body's sort of like play acting a reaction on some level if it had gotten COVID.
Yeah, it's a different breed of vaccine, which is, it's not, a little bit of the virus. It's the mRNA.
That's
technology, but I digress.
All right. Well, let's get into this. We know that the Bessemer vote is under protest right now. The Bessemer vote that took place in Alabama, the attempt by some of the Amazon workers there to unionize. The union representing these folks have filed with the National Labor Relations Board a complaint that the election was not free and fair. There are multiple instances there are plenty of instances that we know of where Amazon spent millions of dollars in trying to discourage people to vote for the union. We also know that there were things that were sort of less inside the bounds, and the bounds are very, very wide, in which they did, including putting a temporary ballot box on Amazon property, because they probably have data that shows that when you suggest for people to vote there, people who are voting against may feel more intimidated to vote against, or those who, there may be a sense of like, hey, they're watching us, I get a vote, even if I'm sort of on the fence, et cetera, et cetera. But the National Labor Relations Board is taking a look at that. Meanwhile, Bernie Sanders made a point of giving a hat tip to those workers in Bessemer. Here he is.
Good to have you here. I was disappointed, but I was actually a little bit surprised that Amazon was so successful in its efforts. And I want to make that clear. This wasn't just workers who decided to vote on something. Amazon played a remarkable role, including requiring people to attend meetings and sort of intimidating them with the idea that if you unionize, our costs will go up and we may have to lay some of you off.
Look, Ali, you got to give enormous credit to the courage of the workers in Bessemer, Alabama. Here you are in an anti-union state. You're taking on one of the largest, most profitable corporations in the country, the wealthiest guy in the world. And you are living under terrible working conditions. I was down there. These people are monitored from the moment they get on the job. It is very hot. It is a huge facility. They got a half-hour break for lunch, and it takes them 10 minutes to walk to the break room. And all they wanted was the opportunity to sit down and negotiate better wages, better working conditions. And Bezos and the company spent a huge amount of money to defeat that effort. And that tells me that, among many other things, we need strong pro-labor legislation, which says that workers in America must have the constitutional right to form a union. And right now it is so difficult, whether it's Amazon, whether it is Walmart, whether it is any one of these large corporations. Companies have so much power to threaten and intimidate, to put people into closed rooms and to tell them over and over again how terrible unions are. We've got to change that.
I want to ask you what model you use for that, because you talk about being in an anti-union state and the fact that so many companies are anti-union, but it doesn't have to be that way. If you look at Germany, for instance, union members have a seat at the board, so decisions don't tend to be made excluding workers. So you don't have this animus relationship between union members and workers versus the company. This is fixable.
Absolutely. And it's not only that in Germany workers are members of boards of large corporations. What we are seeing.
There you go. At the very least, there's some attention that's being paid to this. Obviously, Joe Biden mentioned organizing that was going on in Alabama. There's a lot of other, I think, failures by the union, frankly, in terms of this whole process. But we're going to probably get into that over the next week or two as we look back on this. We get more information. But the bottom line is there needs to be a PRO Act that is going to protect workers, broadly speaking, where you don't need to have the strongest union, the most savvy union. You don't need to have you have a level playing field where you don't have to have a union going up against $25 million worth of a campaign that's being dropped on there, thousands per vote, practically.
Exactly. And you mentioned the USPS Dropbox from earlier in the show, and I in doing some research on USPS for an interview I did last week, Amazon is its biggest client, or I think one of its biggest clients too. So there's that kind of relationship there where they were able to use their power and wield it in order to maybe tilt the scales. And that was just one of the many stories, changing traffic lights so that Amazon union organizers couldn't canvass or talk to people as they drove into the facility. And the fact is that Alabama is as anti-union as it gets. So it was a difficult place to start, but the fight continues, of course.
All right, we're going to take a quick break. When we come back, we'll be talking to Gabriel Winant. He is an assistant professor of history at the University of Chicago. He is the author of The Next Shift, Fall of Industry and the Rise of Healthcare in Rust Belt America, as we talk more about unions and the dissolution of them and the power of workers. We'll be right back after this. Hey, folks, a couple of sponsors today. We all shop online, I imagine. It's particularly in this era, people are getting more and more used to it. I don't even know if it's a thing, right? To even say, of course, everybody shops online these days. And back in the day, I used to spend a lot of time chasing promo codes, tried to instill this in my daughter so she was saving money. Well, but thanks to Honey, manually searching for coupon codes is a thing of the past. Honey is a free shopping tool. It scours the internet for promo codes, applies the best one that it finds, and applies it to your cart. Honey supports over 30,000 stores online, ranging from tech sites to gaming products to clothing brands. I always check out my Honey when I go to J. Crew to get my various colors of shirts that I have. When you check out, the Honey button drops down. All you have to do is click apply coupons. It takes a few seconds. It searches across for the best coupon to fit. And if Honey finds a working coupon, you watch as the price drops. Honey has found over 17 million members, over $2 billion in savings. Whenever J. Crew does not have a sale, I'm always saving a couple of bucks on Honey. Meanwhile, Mila just went back to her, what apparently seems to be her favorite site, Ulta, and she saved $4 on a $15 mask.
There you go. Oh, this is where she likes getting her serums. Ulta
Apparently, where
Beauty.
she buys everything.
Yes, it's a good site.
But that's almost 1/3 the price off that mask.
Yeah.
And I got news for you: the chances that my daughter is going to shop around for a coupon, forget about it. So she's psyched and I'm psyched. If you don't already have Honey, you could be straight up missing out on free savings. It's literally free, installs in a few seconds. By getting it, you'll be doing yourself a solid, supporting this podcast as well. I would, as you know, don't recommend anything I don't use myself, or at least I have my daughter. She seems to be breaking that thing, going at it so hard, but I digress. Get Honey for free at joinhoney.com/majority. That's joinhoney.com/majority. Also, speaking of sponsors that I have used myself, you may not know this, but recent data shows that of all the female-owned businesses, it's estimated that 1 in 3 is owned by a mom. So do you ever wonder how these amazing moms, and frankly, dads, find the time to hire for the businesses while juggling their families? ZipRecruiter. Right now, you can try it for free only at ZipRecruiter.com/majority. CEO and founder Talia Goldstein is one such mompreneur, I guess they're calling him. Besides being a mother of two, her personalized matchmaking company, 3 Day Rule, is constantly growing. She needs to hire several matchmakers a month. So she uses ZipRecruiter. ZipRecruiter's powerful technology helps her find people with the right experience and actively invites them to apply. Talia is not the only employer who loves ZipRecruiter. 4 out of 5 employers who post on ZipRecruiter got to get a quality candidate within the first day. I am one of those. I'm a datapreneur or whatever it is. And
fatherpreneur.
I think I had 2 children when I hired Brendan. They weren't in the office, but nevertheless, they're really psyched about it. Both my kids love Brendan. Anyways, right now you can try ZipRecruiter for free at this web address, ZipRecruiter.com/majority. The special offer is only good at ZipRecruiter.com/majority. MAJORITY. ZipRecruiter.com/majority. ZipRecruiter, it is the smartest way to hire. And lastly, you've heard me talk quite a bit about Quip. It literally came up in a conversation I had the other day. It was a little bit strange to someone I just met very recently. And I couldn't help but start talking about Quip's amazing refillable flosser. I know that's weird. But I'm sorry. I get excited about certain things, and
Good
I have
icebreaker.
Yeah, it's a great icebreaker, of course.
Awesome.
But here's the other thing, and my kids are loving this thing too, and I carry this one around with me all the time. As you know, gum, the unsung hero when it comes to better oral health. Why? You got multiple dentists, including the ADA, that recommends chewing sugar-free gum for up to 20 minutes after meals. Cleans your teeth. Well, Quip reinvented the toothbrush. They revolutionized, as far as I'm concerned, the reusable flosser, and now they've done it again for chewing gum. Quip's new chewing gum is actually good for your oral health. It comes with a dispenser that will remind you of the one-click candy you used to love as a kid. It's like a Pez dispenser, but it's actually better because it flies out. So you can literally do this and it pops into your mouth. It's the best way to carry around gum and not get like pant lint or whatever happening to it. Quip gum, of course, can prevent cavities, freshen your breath when chewed for 20 minutes after eating. It's sugar-free. It has tooth-friendly xylitol, 0 calories. It will definitely satisfy your taste buds. It's got a great mint flavor. It's got one of those crunchy tri-layer design type of things. But it's also no wrappers. And it's a great dispenser. And Quip also delivers fresh brush head, floss, and toothpaste refills every 3 months from $5. Shipping is free, so you can save money and skip the store. If you go to getquip.com/majority right now, you get a free plastic dispenser with any refill plan. That's free dispenser at getquip.com/majority. That's spelled GETQUIP.com/majority. Quip, the good habits company. All right. Want to welcome to the program Assistant Professor of History at University of Chicago, author of The Next Shift, The Fall of Industry and the Rise of Healthcare in Rust Belt America. Gabriel Winant, welcome to the program. I'm here with Emma Vigland.
Hi, nice to be here. Thanks for having me on.
So this is your book is in some part ethnography and in some part sort of a story of systems and really the rise and fall of 2 different types of economies and their relationship with each other. It really is fascinating. Let's just start with this and then we'll circle back around. Give us a sense of the healthcare economy in this country. We got $400 billion set aside in the infrastructure bill, ostensibly to deal with this sector of the economy. There's more to come, but give us a sense of just how big this is, because one of the things that your book reveals is also how little we seem to be aware of it.
Yeah, so healthcare has kind of eaten the economy over the last generation or two. And, you know, there are some ways that you and I might come across this in our daily lives and the costs we pay for care, right? How they've gone up or something. But I think you really see something amazing if you look at it in terms of employment. Healthcare is the biggest sector of employment in America. Now, 14% of all jobs in this country are in the category called healthcare and social assistance. And in particular, in big northern and Midwestern, formerly industrial cities, that number gets significantly higher. So my book is about Pittsburgh, where that number is like 18, 19%, almost 1 in 5 jobs. In the Bronx, which of all urban counties in America has the highest level, it's 25%. And there are neighborhoods in parts of the Bronx, parts of Philadelphia, parts of Chicago, parts of Pittsburgh, parts of Detroit, places like this, where you'll see 35, 40% of people working in healthcare and social assistance. So it's this huge, huge sector. It's exploded. And, you know, you think of healthcare and you think of doctors, maybe you think of, you know, RNs, registered nurses, but it's a major engine of low wage job growth. The fastest growing categories of jobs are things like nursing assistant, home health aide, jobs that are often paid $10, $11, $12 an hour.
So when we say, when there's a high concentration of the economy in the Bronx is associated with that, that is not a coincidence that we're also talking the highest rates of people living in poverty and low income people.
Yeah, and you want to know why, you know, COVID has had this really horrible uneven toll in terms of race, in terms of class, and think about what it means, right? That 25% of workers in the Bronx work in the healthcare industry, and that starts to give you your answer to that question.
Right, they're front line, and they're theoretically meeting with people with COVID every single day.
Yeah.
All right, so let's go back and talk about Pittsburgh, and we should say, we just tell me why Pittsburgh, and what does Pittsburgh? How much does what happens in Pittsburgh also reflect what's happened, you know, in what parts of the country?
Yeah, well, Pittsburgh is a neat case study of the kind of transformation that the whole, what we now think of as the Rust Belt, kind of went through. And you can see it literally on the physical skyline of the city. The tallest building in town is US Steel Tower. It was built by US Steel, once America's largest corporation, to be its headquarters. But the biggest tenant in US Steel Tower is not US Steel anymore. It's University of Pittsburgh Medical Center. So they took down the USS from on top of the skyline and put up UPMC. Like the whole city, right, has a different flag flying now. But, you know, I chose Pittsburgh to study this process that I do think is general to similar kinds of cities, Cleveland, Detroit, again, Milwaukee, whatever, Buffalo, Rochester, because it was such a kind of classic case of a great American industrial city. If you go back to the Korean War or so, 1950, almost half of all jobs in Pittsburgh were industrial jobs. Steel, most of all, right? Steel is what we think of when we think of Pittsburgh, but, you know, mining and rail and warehousing and trucking and other kinds of manufacturing too, electrical work. And so Pittsburgh kind of exaggerates for us a process that the whole formerly industrial part of the country went through, if we look at how it changed.
And I should say some of it, I mean, you know, maybe I just tend to be central Massachusetts centric in my worldview. But I think there's some examples in Massachusetts too. I would imagine there's throughout New England. There's
Worcester, Fall River, any kind of place like that.
Yep. I certainly recognize it from Worcester, and maybe even arguably Lowell and a couple others. But the point being that this is a dynamic that's happened both Northeast and the Rust Belt to varying degrees in terms of their reliance on this. Okay, so give us a sense of the progression of what took place and what the nature of the jobs were when you were a steel worker, let's say, or one of these, you know, it could be, you could have been working on an assembly line for cars too, on some level, but tell us what the dynamic was in that era.
Yeah. So I think now we have a tendency, especially political progressives have a tendency to kind of romanticize this era, right? Because it's true that a steel worker or an auto worker would be making the equivalent of what's today, maybe $25, $30 an hour. You know, had much better health benefits than today, had much stronger unions, than today. And so there's a reason that we look back with some nostalgia to the world of the blue collar worker in the middle of the 20th century. But, what my book is trying to show is that there were things about these jobs that made them really brutal for people. Often industrial, factories ran 24 hours a day. Steel mills certainly did. And so that meant that very often maybe you were working night shifts, right? Or one week you're working night shift, next you're working day shifts. Injury rates, occupational hazard were really high. Everyone who spent a whole career in a steel mill saw people die, horrible deaths, had injuries themselves typically. And there's just an intense form of kind of alienation that came from, being this kind of provider, breadwinner figure who had to kind of keep your family going, and knowing that this was a kind of honorable and heroic thing to do as everyone saw it, and yet feeling miserable all the time, right? And so again, a lot of people who work these jobs or whose dads work these jobs, I mean, they'll tell you about alcoholism and domestic violence and these kinds of things. It was not an easy life by any stretch. And underlying all of that, and this is the last thing I'll say about it, underlying all of that was the fact that it was gradually always falling apart economically. So that kind of work reached its peak in 1950. In 1960, it was smaller than it was in 1950. In 1970, it was smaller than it was in 1960, and on and on. And so even back in the golden age already, people were starting to wonder, God, how long am I going to be able to keep this job? Am I going to be, full-time next week the way I was this week? There was insecurity always eating away at the edges.
And you gave us a sense of the proportions of how many, people work in the healthcare sector now in these communities. What was that proportion like for, say, the steel industry back in the day?
Yeah, so in Pittsburgh in 1950, steel was about 20% of all jobs, so similar level to healthcare around now. Manufacturing in general was more than that, but steel and metal production was about 20, which is very high, right? It's a very intense degree of specialization.
Right. I mean, every fifth person you're meeting, more or less, is associated with that. All right. So let's talk about what happened in terms of the development of healthcare. This story about Truman making, heading into sort of pushing for universal healthcare, and the unions creating what is the term? I mean, I want to say a trajectory, but like a determined path for where on some level, some of our fate was sort of sealed here, because unions were trying to just basically provide for these type of workers.
Yeah. So, once a generation, this country has a fight over health insurance, basically at the political level. It happened in the 1910s. Nobody remembers that anymore. And it happened again in the 1940s when Truman was president. And the war was over, and they thought they were going to continue the New Deal, basically, right? They had established Social Security and unemployment insurance, and these kinds of things, and they turned their attention to healthcare, thinking this was next. And Truman's big kind of battalions of social support for doing this, his main social base, was the new industrial unions that at this time were really dynamic. They were growing, they were exciting, they were militant. People really identified with them. That's the United Auto Workers and the United Steel Workers and United Electrical Workers, big unions of manufacturing workers, United Mine Workers. And a bunch of different factors came together to stop that from working out. Basically, they're trying to achieve what we would now call Medicare for all. And you could summarize it basically that the onset of the Cold War made that harder to do for various reasons. That, kind of the rising tide of anti-communism kind of beat back that effort.
Let me just stop there for one moment. So what's interesting is there was a ideological, almost, not just a question of big entrenched interests at that point, but it was more of an ideological. Is that right? Or is it just that the big entrenched interests had an ideological as opposed to like sort of a political economy type of
Well, there's both going on, because the big entrenched interest in this time actually is the American Medical Association, who, organized medicine today are actually much, much weaker than they were then. So it's hard to imagine doctors having this kind of sway. But organized medicine in the 40s was very strong and was very conservative. and in alliance with a kind of anti-communist, increasingly kind of McCarthyist politics, was able to beat this back. And the union movement itself is undergoing serious turmoil and increasingly internal conflict along the same lines, right? The mainstream unions were purging the left-wing unions and having these civil wars and things. And through all of this, the labor movement thought, you know what, we're going to keep our name on the paper saying we support Medicare for all, but seeing like it's probably not going to happen, let's get some health insurance out of our employers. And the auto workers and the steel workers and the miners all started pushing in the late 1940s for their employers to cover their members. And that basically is where employment-based health insurance comes from in this country. That's how it became a widespread phenomenon, was these unions built these private sector welfare states for their own members.
And this is like increasingly part of your story is about this sort of public-private welfare state that gets developed. That's also the case with prisons on some level too, I guess. So you have now this private sort of welfare state that is developed because through union dues. And so what does that grow into, and then how does that relate to this story?
Yeah. So, basically in the late 40s, they negotiate these plans, and over the 50s and 60s, these plans get good. Workers are on strike all the time in the 50s and 60s in the big industries, and their coverage starts to get, it becomes something that you and I today would be like, oh my God, I've never seen anything like that. Right. Folks who have parents who were in these industries will remember this. And they use the hell out of it, right? It's like they have this really powerful kind of access to a certain kind of care, and very understandably, I think working class people are like, I can go to the hospital and they don't tell me to leave. I'm going to stay for 2 weeks. I'm exaggerating it a little bit, but not by much. This, however, causes the costs of care to rise inevitably, right? There's this booming working class market in industrial cities. Hospitals think we should expand, we should build a new wing, we should buy new equipment, we should jack up prices. As that happens, people who don't have in through their unions, they start to get priced out of the market. And in particular, if you think about who is that, right? It's not the wealthy, because they can just buy their own access. What kind of working class people aren't going to have access? It's the poor and the unemployed, who are kind of below the union standard, and it's the elderly, who are retired and so are out of the workforce. So that leads to the pressure for Congress to pass Medicare and Medicaid in 1965. That's basically where that comes from. And once by the late 60s, you have Medicare and Medicaid and these private sector collectively bargained plans functioning together. You have this massive stream of income into the healthcare industry through what I'm calling the public-private welfare state. The other key part of this, I was saying before, they use the hell out of these plans, but in particular, I was mentioning earlier how, every decade there are sort of fewer and fewer steelworkers. As a community goes through deindustrialization, it gets older, right? Young people sense that there's not going to be opportunity and they leave. And this big cohort of steelworkers you had in 1950 are approaching retirement. So the population is getting older. As it gets older, it gets sicker, both because older people are sicker and also because laid off people are sicker. When you lose your job, you're likely to suffer health effects, and it's getting poorer. So older, poorer, and sicker together. However, they have this huge healthcare complex that's been built up to serve them. And that becomes one of the main points of access that people can kind of maintain to social services as other things are starting to fall apart economically.
Two points there. I want to get to the main point of access and sort of tease out what that means a little bit more, but in terms of like real world experiences. But this dynamic of what's also really interesting to me is this dynamic of the youth drain that is a function of unions protecting seniority. And as these industries contract, young people are like, I don't have an opportunity here because I got in, I'm late to get in, so I'm going to leave. And so you have like a Pittsburgh that, I don't know, halves in its population or
Yeah, Pittsburgh is less than half of its peak population today.
wow.
And that's, outside of New York City, which is about the same as it was in 1950, and obviously has other things going on that kind of keep the population up there. I live in Chicago. Chicago is significantly smaller than it used to be. I grew up in Philly. Philly is significantly smaller than it used to be. And these are among the success stories, right, of deindustrialized cities. If you think about a Detroit or, again, a Milwaukee or Buffalo or whatever, even smaller towns like Gary or Youngstown, you'll find places that are just tiny fractions of what they used to be.
Worcester, incidentally, actually increased its population by literally a few thousands from 1950. I don't understand that.
The
but
Paris of the 80s.
Exactly. That's that I still have that T-shirt. But so that dynamic hits. I mean, what's interesting about this too is we should say, and I probably should have mentioned this at the top, is that when we think of healthcare economies, we imagine like Arizona or Florida or Nevada, right? Where theoretically old people move for retirement, but that's not the case.
Yeah. Right. So everyone always asks me, like, they hear what I study and they think, okay, well, that must be a story about these kinds of Sunbelt retirement communities. And it's true that they just don't register in the way that all these kinds of cities I'm talking about do at the level of healthcare employment, because they're old, but they're not old the same way Pittsburgh is old. It doesn't mean the same thing that they're old, right? Because they're old because wealthier elderly people relocated there and, brought all their resources with them. Pittsburgh is old because working class old people were stuck there.
And their jobs just took more of a toll on their bodies. And so what does that mean now that the hospitals at that juncture, and then I want to get into sort of like the disparity between like a community hospital and a research hospital, but what does it mean that it becomes a point of access? Like, is this like, does it replace like the VFW hall, or, I mean, like, what is it, or what happens there?
Yeah, well, I mean, to some extent, yes, people have these real meaningful social ties to their community hospitals. So if you go to one of these steel towns just outside Pittsburgh, Homestead, Braddock, McKeesport, the sort of ring of towns right around it where the mills were, the giant steel mill would have been at the bottom of the town. They're all on a hill. And then basically across the street, or maybe 2 blocks up, you would get to the hospital. And each town had one. And that, the people who lived in that town and worked in that mill went to that hospital. And, these were nonprofit private institutions, sometimes Catholic institutions or something like that. But people really felt like they kind of owned them. I like to tell a story, or I tell a story in the book about Homestead Hospital in the 60s. The population was shrinking. Not that many babies were being born because of the things we've just been talking about. And meanwhile, the main medical surgical parts of the hospital were overfull because they had all these well-insured old people. And so they said, let's close our obstetrics unit and, turn it into medical surgical. And there's this outcry from the community of Homestead that our hospital has to be a place where babies can be born. There's an organization of women who volunteered photographing babies in the hospital, newborns, who bring a lawsuit and they win. This elected judge says, I think it's significant that he's elected because it suggests there's kind of popular democratic power behind this. Says, no, actually, a hospital has to be a place where babies can be born. If you want to, rewrite your charter and become a different kind of organization, feel free. But until you do that, you have to keep that unit open. And I think that's a kind of good example of how people really feel like they have some ownership over these institutions. They have surprisingly kind of deep relationships to them.
And it's also the accountability that the hospital had to the community. I mean, it's whether, that they couldn't just pursue profits at that time.
Right.
However,
their nonprofit status actually kind of meant something.
Right. But however, what happens as we sort of move forward with the type of care, like we get this disparity between what's happening at the sort of the research hospitals and like Homestead, these community hospitals.
Yeah. So, first there's this period, basically the 1970s into the 1980s, when economically Pittsburgh has fallen apart and the hospitals are just doing great, including these kind of smaller community hospitals, because they can feed on this economic displacement, right? People are losing their income, are losing other sources of security, but they're old and they're sick and they have good insurance and they go to the hospital for a lot of different things. And so these are like the boom years for even these community hospitals. But, as this process starts to play out nationwide into the early 80s, it means that the healthcare system is growing and growing and growing in a moment when the rest of the economy, particularly in industrial centers, is kind of contracting pretty sharply. And health inflation is taking off even after the Fed has started to really deflate the economy starting in 1979. So Congress gets worried about healthcare costs, and in 1983 changes the rules for how Medicare reimburses hospitals. This sounds boring. It's actually incredibly important.
It's not boring to me. I've been waiting to get to this
Okay.
prescriptive billing versus the retroactive billing.
So up till 83, from 65 to 83, the way Medicare paid hospitals was the hospital did whatever they did, and then they sent the federal government a bill saying, okay, this cost us this much, give us 102% of that. And it meant that they couldn't lose money, right? They whatever they did, they were going to have a positive margin on. So that's called retrospective reimbursement, right? Congress said, okay, we got to impose some market discipline, some competition on these hospitals because they are like eating our lunch. So they switch it to what's called prospective payment, where the federal government writes up a list of several hundred possible diagnoses and says, here's what we're going to pay you for each of them. You pick what the patient has a diagnosis of, and with some adjustments for regional labor costs and things like that. That's what you're getting. You can keep them for a day, you can keep them for a month, you can spend however much you want. That's up to you. You're working off a fixed price sheet. And this causes this big shakeout in the hospital industry over the course of the 80s and into the 90s. Basically, the big academic and research hospitals that have a lot of capacity for doing technologically or scientifically kind of complex interventions. Here in Pittsburgh, the classic case is transplants. They do great, actually. Their margins go up because this new system rewards sort of very costly diagnoses. However, the institutions like Homestead Hospital that had been doing great on basically being semi-nursing homes for years, that model doesn't work at all anymore. And those institutions all go under over the course of about 10 years after this reform and get bought up by the big academic medical centers. So that's how you get a UPMC that I mentioned at the beginning of this conversation, the University of Pittsburgh Medical Center. The big university hospital buys all the distressed community ones and takes up market share. That then, we can get into this if you want, that then kind of sets off this complicated dynamic sort of arms race between insurers and hospitals that you may recognize from the 90s as the managed care stuff.
Yeah, this is fascinating. Okay, I'm sorry. I just want to just note, like there's that piece that I cite a couple of times a year. It seems like Atul Gawande's piece on the two Texas towns and the cost of Medicare. Those guys with the heavy equipment are charging a lot more because they're finding specific diagnoses that they can treat that are just more expensive care. I'm just doing, and that's sort of distorts things. Go ahead, Emma.
Yeah, just before we moved on from that, you mentioned I think you mentioned something about nursing homes, because I wanted to ask you how the increase in nursing home patients and the rise of the nursing home industry played into this dynamic in the 80s.
Yeah, thanks for asking that. That's a key piece of this. So, once these community hospitals get destabilized in this way, and I said they were kind of functioning as informally as nursing homes, basically, actual nursing homes and also home care agencies realize that there's a market opening for that, right? That they can provide this kind of long-term care, labor-intensive care, right, as opposed to the capital-intensive care that they're doing in hospitals. without having to actually invest in all that, plant and equipment and stuff. And this has always been the kind of predatory, like the real bottom feeders of the industry. This is really where you find them. They realize they can finance most of their expansion with public money. The public will subsidize almost any capital expansion in this industry. So they borrow using public subsidy. All of their income comes from Medicare and Medicaid. And they set up shop really rapidly over the course of the 80s and 90s, getting elderly people into nursing homes and to some extent into home care.
And okay, and so we're left with this dilemma, and the theme that runs through all this is essentially that all the jobs we've created this sort of medical industry, which in some respects is good. It's not necessarily organized the way we would want it, but these behemoths are making massive amounts of profit and are able to just basically. Part of it is just by consolidating and then keeping wages low, right? I mean, that seems to be the big dilemma that we have. In fact, I think at one point you call it a trilemma. What is that trilemma?
Yeah, so the trilemma is something that's faced by all kinds of deindustrializing kind of, wealthier societies around Europe and the United States. And basically it's that when you trade industrial jobs for service economy jobs, you lose the dynamic within the industrial economy that allowed for everybody to kind of win at the same time somewhat, right? Which was a productivity increasing, basically steady productivity increases over time meant that employers could make money, but workers could also have pretty steady, wage increases. And, there was a kind of compromise that was possible through that. And that's what, when we think of the 50s and 60s, that's what we're thinking of. When you trade that out for the service economy, you lose the basis of that compromise, because most service industry jobs, healthcare jobs, for example, you can't really increase, productivity per hour in any similar kind of way. Or if you do, you're doing it at the cost of the quality of the service itself.
Right.
So that sets up these more zero-sum choices, so long as you're like in a capitalist society that, organizes survival and work in certain ways. And these zero-sum choices, the idea of a trilemma isn't mine. It comes from political scientists, but I'll just describe it quickly. Basically, policymakers can choose 2 out of 3 things that they want. They want high wages, they want low unemployment, and they want low public spending. And they can have any 2 of those 3 is the idea. But you can't have all 3 because one is going to cut against another in some form. So the US has chosen the route of low unemployment, low wages, and low public spending relatively. And that means that we've done better than Europe in terms of unemployment, actually. But, we've proliferated these jobs that, like I said, people can't really survive on, even though we depend on them to take care of us.
So the outcome of that, being able to sort of find that comfortable place that supposedly creates some type of like political equilibrium, is that there's just a lot of people living on less money than they really need to live, essentially.
More and more every year in this industry. And again, we really depend on them. I mean, that's the irony of it.
What you spoke about the different moments where we had these healthcare battles, right? And it sounds like a little bit of like what happened during Truman also happened during the ACA fight, which is like all we're doing, or I should say with Medicare and Medicaid in 65, all we're doing is we're looking at where the gap is and how can we fill that without having to expand government's role in that in the most minimal way possible. Right. And so it's like, we're just going to cover people 65 and older. And, maybe at that time it's like, and people don't make it to 65 so much. And in Medicaid, we're going to put a threshold where it's really low. And so it's not really going to serve, the number of people that we need it. The ACA expanded that threshold And now we're sort of, one of the headlines I read today was just Pelosi and Sanders are going to fight over an expansion of that ACA or Medicare. Drop the Medicare age down to like 50, 55 or something to that effect. But what can we do about the wage end of it?
Well, I mean, the problem here is that this kind of nibbling around the edges dimension of it is really connected to the wage problem because, the story I've been telling you this last half hour is about how the public created the healthcare industry to meet our needs. We did a lot of it through the private sector, right? But it's public policy, it's politics that created the healthcare industry. However, we subcontracted it, basically, right? I mean, that's more or less what happened. We created this thing and we subcontracted it. And that means that these millions and millions of workers, I mean, we all know what a subcontractor has to deal with, right? They're sort of informal public employees. And that means that nibbling around the edges of the healthcare system, the way Obamacare did, the way even Medicare and Medicaid did, while leaving this monolith of private administration and ownership intact, is going to keep the wage problem there in some form. We can do things about it. We can support workers' unionization. We can regulate staffing levels more than we do. I'm not saying there's nothing to do, but and those are really important. They're the first things that workers or the unions in this industry will say to you. But so long as the federal and state governments subcontract responsibility for this basically public service to the private sector is going to make money the one way it can, or one of the two ways it can, right? Which are gouging the patient and driving down the wages of the worker. Those are the only ways they have to make money. Right.
They're arbitraging the money that's coming in from these unions or the federal government and the state government and just making sure their costs are lower so that they can put money into their pockets. I know you've got a heart out. I could talk about this for a long time. It's a really fascinating book. Gabe Winant, historian from the University of Chicago. The book is The Next Shift, The Fall of Industry and the Rise of Healthcare in Rust Belt America. Thanks so much for your time today. We'll put a link to that at majority.fm.
Thanks for having me. This is great.
Thank you.
All right, folks. We had a little bit of a late start today, and so I would have loved to have gone another couple of minutes with him. My apologies on that, folks, but maybe we will revisit. I'm going to, in the near future. He is and I should say that Winant was a union organizer, I think, at one point, and he has another book, too. Maybe we should have him on for that as well, as a way of justifying having him return. But in the meantime, we will take a quick break. And when we do, we will return after that break. We're back, folks. This fight that is going to take place, and really has begun, as to whether we double down on the Affordable Care Act or expand Medicare is going to be a real crucial one in terms of structural things. Nancy Pelosi, an avowed opponent of single payer healthcare, apparently also just an avowed opponent of expanding Medicare.
Well, because when you do that, that could lead the way to single payer healthcare.
It is, and you're covering more people under a single payer healthcare plan, and
it makes it clear, why don't we just expand this to everybody? And
it
that's what
starts to
Democrats
make
like
you
her.
wonder, doesn't it? Because also remember, we also, we have S-chip programs, but we could expand those and make those more. We could expand coming from both directions in terms of ages. Pelosi wants to make permanent the temporary expansion of the Affordable Care subsidies included in the $1.9 trillion stimulus legislation last month. Sanders is arguing for lowering the age of Medicare eligibility to 55 or 60 and expanding the program for seniors so it covers dental, vision, and health care. Remember, the expansion of the ACA, there's two parts of it. There are subsidies in the private exchanges that go a little bit higher in terms of who gets those subsidies, as opposed to just cutting at 400%, 400% of poverty. There's also the expansion of Medicaid, which I don't know if it is necessarily a function of the ACA. Don't know that those would have to necessarily be trade-offs. But reminder, the ACA, it applies to, I don't know, 10, 11 million Americans. We've had 500,000 more sign up as of late. 10 or 11 million Americans, does nothing to control the cost of healthcare, does nothing to make our system more sort of like cohesive or logical in any fashion whatsoever. So that is a bit of a problem in terms of running a healthcare system. Part of what we're seeing in this infrastructure is an expansion, $400 billion heading towards healthcare. And there are some, like infrastructure expert Chris Christie, who understands the real value of infrastructure, folks.
Yes, he loves those bridges, right?
Oh, he also has a thing for tunnels, but we'll talk about that in a moment as well. Here is Chris Christie. He is on George Stephanopoulos' program, ABC The Week. And here he is basically just flacking the Republican talking point.
You cannot call a $400 billion plan to force unionization in states to say that taking care of increasing Medicaid payments in states is infrastructure. Now, language does matter. We learned that in the last 4 years, how you use it and what you say. And I said last week that the president's not telling the truth, and he's not telling the truth about the infrastructure package. This is the care economy. This is care infrastructure. It's baloney. And so what's going to happen is the president right now is in the first 100 days, and he's going to have that soothing persona and all the rest of it. But when people start to look at what he's really doing, George, those moderate voters.
But even the things you just mentioned right there are popular. People would love to have Medicaid increase.
People would like their grandparents to be taken care of.
Here's what's not popular. Lying is not popular. It's not infrastructure, George.
Interesting. You really want to use the word lie there?
If Donald Trump, listen, let's just be fair here. If Donald Trump had come out and called a dog a cat, which is what Joe Biden's doing, we would be outraged by the fact that he's lying. But with Joe Biden, somehow it's like, oh, well, come on, it's Joe. No. It's not true. If he wants to make the case, George, for increased Medicaid payments and connected to those payments, mandatorily using SEIU union members, let him make that case and see if he gets it passed. I know he won't. And the people around this table, whether they'll say it or not, they know it won't pass either.
Look at the state of the Republican Party's talking points against this infrastructure package. This very popular idea doesn't technically meet the definition that we're ascribing to it as infrastructure. So yeah, he's a liar. Let's scrap it all together. I mean, when Chris Christie said lying is not popular, one, Chris Christie, known liar. Two, he was a top surrogate for the biggest liar in the history of American politics. So it seems like the American people aren't as concerned with the lying aspect because, shocker, every politician lies. It doesn't matter who they are. They're a little bit more concerned with what is going to improve their lives, not the definition of infrastructure as the Republican Party wants to prescribe it, not the lying about it aspect. They're very much more concerned with what's in the bill.
I think it's a really super weak, you got to do a 3-step dance here for this, right? I mean, Marsha Blackburn tried step number 1 with her big meme, $400 billion towards elder care, as if this is supposed to scare people.
Right.
It's anything but infrastructure, $400 billion towards elder care.
Very scary font.
We wouldn't want care for our elderly. We don't want to include that as infrastructure. First off, it is the care economy. We just had someone on the program describing how much of our economy is dominated by healthcare, and it is going to continue in that manner. Part of the reason why it's made so invisible is because people don't want to pay for it in any way, and there's so much profits being made by these hospital organizations over it. But this is a guy who, if infrastructure, understanding the dynamics of infrastructure is so important, this is a guy who refused the stimulus money in 2010, 2009, to build that other tunnel under the Hudson River. And it's become extraordinarily more costly now just to do it 10 years later. And it's going to happen, it's happening. You need it. And he refused to do it. So I mean, it's just the idea that this is going to fly, this notion of trying to gin up anger against infrastructure, it is really, it's going to be tough. Now, with that said, they were mad about the Affordable Care Act because of how many pages were in it. And that had some resonance, but I just don't think that people are going to be out there going, Joe Biden's a liar, because his definition of infrastructure includes creating a context in which people can get care as they're older. That doesn't seem to me to be something that is going to, in those Trump rallies, it's just not going to resonate.
This is a real grasping at straws moment. I mean, everything since Biden has come into office, the right has had zero idea as to how to attack him, and they haven't found their footing yet. And this is just another example of it, in my view.
Well, that's it for us today, folks. We will be back tomorrow with more, as tomorrow is Tuesday and today is Monday. So that's the way it works around here. Don't forget, if you missed any part of this program, you can check it out at 10 p.m. on the Peacock app on the Choice channel. Also, you can see the extra interviews Em and I do at 5 p.m. on the Peacock app. And for those of you sticking around, you can see us right now.
You are looking at us or listening, potentially.
Yes, indeed. Here's I just got an IM unemployed Zoomer. Fantastic interview today. What term would you use to describe the type of history that Gabriel Winant is working within?
American history?
I don't know. This is like one of those, it's an annoying question because I could come up with like, labor history, American history. Is he looking at it through sort of like a Marxist analysis of the economy? Is it? I don't know. I can't tell if that's just sort of
that involves your favorite kind of thing, definitions.
Well, it's just I'm
being sarcastic. I
know, yeah. And I just like, just say what you want to say. I find that type of
There's
question.
power in taxonomy, Sam.
Yeah, I get that's the thing that I find so annoying about it.
We can ask him and see what he says too.
We can, but it's also like the answer to that question, the subtext to the answer to that question is whatever will limit who's willing to hear this. That's what, like, when you insist on this taxonomy, and this is almost like the same issue I had with Sanders, opening his campaign with sort of a, defining, or wanting to teach people about democratic socialism. It's like there's no political value in that as a political tool, at least in terms of a retail tool. Like, I understand the value of it amongst like sort of closed systems, right? I understand the value of that taxonomy, but in the context of something that's going to go out and try and convert people, anytime you use a taxonomy, a label for it, you're just, the only benefit that you're going to get is, well, there is no benefit. The only possible implication of that is that you will either have no impact on how that message is received, or you will diminish the ears that are willing to hear it. There is no increase. There is no increase. And that's why I find I don't have a problem with it. In the context of like, people have discussion. I find those conversations, frankly, interesting, but it's why I don't engage in them, because that's not what I'm doing here. I'm not trying to convert people to a specific ideology that is defined by, that is, the definition of which is in constant flux or argument. I am trying to get them to subscribe to a very broad worldview through different policies and make them see certain worldviews without having to have it named. Other people can name it. It's just not interesting to me. So don't forget to smash that like button, says Chardonnay Socialist.
Smash it.
Folks, this program relies on your support. You can become a member at jointhemajorityreport.com. When you do, you not only support the free show, you also support, you also get the fun half, and you get the free show free of commercials. So why would you not do this? Also, link and subscribe to our YouTube channel or to our Twitch channel. You can subscribe over there. Poggers, we got a bunch of great memojis over at our Twitch channel. So check that out. Don't forget AM Quickie, amquickie.com. Get your morning headlines, and justcoffee.coop. Fair trade coffee, tea, or chocolate. Use the coupon code majority. Get 10% off. Does anybody know who's on Nomi's show? Oh, it's today's Monday, so nobody's on Nomi's show. But check out Nomi. She'll be back live tomorrow at the Nomiki show, or youtube.com/the Nomiki show. Matt, what's happening in the Leckian media empire?
Workers are still organizing, folks. We talked to Nathan Bernard about Maine nurses and the liberal union buster that's coming up to try to stop them from organizing and make them feel heard. So check that out on Thursday.
Is there a vote going on right now in Maine?
Yeah, it's going on right now, and it wraps up at the end of the month.
April 29th, correct? Yep.
That's correct.
It's all going to be, like I say, healthcare, I think, is just such a huge, this ultimately is the battlefield. And both in terms of how we're going to pay people and how we're going to care for people. And also the after food, I guess in shelter too, on some level. I don't know how you would parse that out, but healthcare, so crucial to both helping workers and, who are actually involved in healthcare, having a single payer healthcare system, and also in terms of helping workers who are not involved in the healthcare system. I mean, just taking that off the table is going to give workers a lot more, I think, bargaining power. And it's going to be hard to sort of like to work this with unions, right? I mean, because unions, one of their big selling points have been for 50 years, 60 years, 70 years. 70 years has been one of its selling points has been its healthcare, what it provides in terms of healthcare. So, all right, folks, going to head into the fun half of the program. 646-257-3920. 646-257-3920 is the number.
C'est sur la poupée qui fait nanana toute la journée. Il fait nanana elle est que j'en reparle.
JJ Cool. Sam, I agree with your position on taxonomy. That said, when it comes to the Bernie campaign, don't you think a lot of it was an attempt to get out ahead of the media narrative? They were always going to call him a socialist or communist, so he would try to define his version first. Yes, and I don't think that is, I don't think that instinct was wrong. I just think that the way that they approached it was wrong. In other words, that first speech could have been, you will hear that I am a democratic socialist, or I am a socialist, or that I am a, whatever. If supporting the right for people to have health care makes me a democratic socialist or a socialist or whatever, then fine, I'm one of those. That's why I call myself one of those. If supporting, free college education and supporting universal pre-K makes me a democratic socialist or a socialist, yeah, that's why I call myself that. I mean, that's it. That's what you needed to do. You didn't need to get into the specifics or the philosophical underpinnings or the ideology. You didn't need to make it about selling that as a product. You needed to make it about selling what you were going to do as a product in that moment, in that speech. And that's what would, defend. I mean, the desire to get out ahead of a critique is one thing, but the way in which they did it was, I think, wrong. I don't know if that had any material difference with the campaign, but that's just I use that as an illustration for, what my approach is.
Yeah, no, I mean, hard to ascribe exact blame as to what fell apart there. But
I don't know that. I don't think that was it. I just found that frustrating.
It was the
at
pandemic
the time.
more than anything. It was the and also the coalescing behind Biden by the powers that be.
Calling from a 215 area code. Who's this? Where are you calling from?
Hey, Sam. Hi, it's Mindy. How are you?
Mindy. How are you,
Hey,
Mindy?
I'm good. Emma, I got so sick too after my Moderna. Did you have Moderna?
No, I had Pfizer. But
awful,
everyone's
wasn't it?
different.
Okay. Hi, guys. The reason why I'm calling is my husband, as a hobby, he does like everyone's taxes, we know, because he loves to do it. So since the Trump tax cut thing, I don't know if you guys are noticing, but like anybody between like over 100,000 to like 350 is getting so screwed on their taxes. Like he used to, like for instance, my, do you know, are you hearing anything about this? Like how it's so bad with the taxes?
What does that mean between 100,000 and 350?
So if you're making 100, so if, like our kids make between like 100 and 3.25, like married together as couples, we have that range.
Okay.
Well, we have like a range of 150 to 3.25 our kids.
Do they own homes?
What?
Do they own homes?
Well, wait. So that's what I wanted to say. So the one on the lower end, the teacher and the marketer are one of our sets of our kids. They make like 150, and they had they own a house as a rental property, and they used to be able to like maximize on the rental property. They paid in $14,000 in taxes last year, and my husband was only able to like shave off $4,500. And when it was all done, instead of getting money back, like they used to get back like $4,500 or $3,000, they owed over $1,100 this year. And
that's because
my daughter,
the SALT deductions are gone. The state and local taxes deductions are not there over $10,000.
Yeah, so they basically gave them $1 extra in their paycheck, and they took $2 off the back end. So like he was here yesterday, and my husband's like, you just might as well sell the house, the rental property, because it's not doing anything for you. So our other kids, like my daughter just bought a house, and she had to pay in some extra money this year. And it's just like everybody, what I'm trying to say is like the whole middle class, like the upper, not the upper middle, because we're definitely not upper middle, but like that middle class where we can fend for ourselves people, we're getting so screwed. Yeah.
Well, Mindy, if you're making $200,000-$300,000, you're not middle class.
You don't think?
Well, I mean, you can go and find out. You're top I don't know, $300,000 a year is like pretty close to top, I don't know, 5%, 1%.
No, but like we used to be able to like have like what I'm trying to say is like they're squeezing everyone under 350,000. So like basically my husband was trying to explain like anyone that makes over 350 as a couple basically got like a $50,000 a year raise from Trump's tax cut, and we went in the other direction.
I mean,
the
salt,
what?
the salt I mean, this is the salt deductions are, you know, is basically what's happening there. And the fact of the matter is, though, is that like 80% of the value of salt deductions,
What's that salt deduction?
Salt is the state and local tax deduction that you get to take against any taxes. So any taxes you pay on a state and local level, you get to deduct those from your federal taxation bill. And however, it was capped under Trump. And so the value of those doesn't accrue to people. But the fact is that if you were to get rid of those, it would benefit 80% of the people benefiting. This is just off the top of my head, make at least over like $300,000 a year. So they're, you know, but I should tell you, if you make $300,000 a year, at least in 2016, you were in the top 2%.
That's household
of the country,
right? Yeah.
All my kids are complaining they don't have any money. I mean, they're all complaining about it. They're all like, they can't buy houses. They can't. They're just.
I mean, join the club there.
It's an especially bad time to buy a house right now too. I think house prices are the highest they've been since 2006, which is more of a problem.
Yeah, I'm curious about.
Well, they can't like one side of our kids is trying to buy a house, and they can't even if they say they want to put in they want an inspection, and first of all, they can't even get to negotiate or even bid on it, because like if it goes up for sale on Monday at 3, it's sold by Monday at 4 where we live.
Right,
so,
right. That's happening, I think, in many places across the country. So, you know, they wait. I mean, these prices are not sustainable, I don't think.
But what I wanted to tell you is like Trump screwed the middle class people. Anyone making over 100,000, under 350, you don't consider that middle class, but
it's not. I mean, by any definition, it's not.
Yeah, but if you're making 75 and you're single, you're doing like way better than a couple making 150 married.
Well, that's true, but that's not what that's true. But I mean, if you're a couple, you're making 300,000. I mean, an individual, I should say 300,000 probably, but I mean, 300,000 as a couple still.
That's what I'm saying. So like that's 150, whatever, divided in half. Then that's what, the top 15%?
I would imagine
150K.
Yeah, but living in New York City in an apartment for $5,000 a month. I mean, it's like.
But don't you live in Pennsylvania, Mindy?
Well, I do, but my son, the ones that the two live in New York. One's the teacher, and the other one lives in Jersey. But they were like on the road to like being self-sufficient, like being able to maybe buy a second vacation home at some point. It's just at the point now where it just seems like the middle class, or what you call the 2% or whatever you call it. It's just like they're not going to be able to have that added entertainment that they could have had if Trump didn't do that thing and the GOP didn't do that thing with the tax plan, where people that were making so much money are getting so much more richer.
Yeah.
And these people that are working their asses off, you know, with great, I mean, our kids have degrees on top of degrees, and they can't, I mean, it's not, I'm not saying woe is me. Oh God, I always sound like that when I call. But do you understand what I'm saying about my little world? It's just like, it's messed up.
I got you. I got you. I mean, you know, it is New York City is expensive. Expensive, but I mean, I think like this is you can imagine what the median a wage I would imagine in New York City is closing to it's closer to $50,000 a year, I would imagine, and you would imagine what it's like at that amount.
I can't imagine what it would be like at that amount. It's just that he used to be able to sit there and help them deduct, and now, and at the end they were good, and now at the end there's just nowhere to go with it. They eliminated every If you make less money, you're in way better shape.
I'm not 100% sure about that.
That's never the case.
That is not true.
Come on.
You may pay less in taxes, but you're not going to put more in your pocket.
Okay, I'm sounding
And I will also say this, Mindy, that those provisions that give any type of tax relief for people at lower incomes is going to zero out in like 2 or 3 years anyways.
And I gotta say, Mindy, most people's kids aren't thinking about buying a second home, you know?
Well, no, I don't want to come off that way. I'm not coming off right. I'm just saying, like, they worked so hard. They went to school. They're having, they're all starting to have families. They're talking about, they're spread out across, one's in Michigan and one's in New York. Like, we wanted to just be able to see them. And it's just like we were talking, it's just not the way it was when I was little. Like,
what about student loan relief?
That is true.
What?
Student loan debt relief.
Yeah, it's just not the way. The loan debt relief's bad too. I mean, one of that's a problem. I mean, well, 2 of them don't have loans. One, the loans were paid. One will be forgiven if she works in her job for 10 years. It's just not like our house, the house that my husband and I have. My kids can't buy a house like this because it's not worth.
Well,
they can't afford. You know what I mean? Like,
yes, I understand, but Mindy, you realize like. The frustration that you're talking about becomes like significant pain as you start to move in with the vast majority of people.
No, I understand that, but I was just trying to say that I guess the reason I was calling where I didn't mean to sound so stupid and out of touch was I guess what I was trying to say is that there's little possibility for people at that bracket to get better.
Well, that's true across
Mindy,
all
can I just,
brackets, though, Mindy.
What I'm interested in, Mindy, is how this develops in these people's attitudes. Do they start to get pissed off at these ultra rich Jeff Bezos type monsters, or do they start resenting the left or people who want taxes raised? Because look, like.
Or the idea that people who make less money are doing better.
Yeah, it's like
right, exactly.
With,
like that
going
is
on the ACA, like being in the ACA market and not getting the subsidy costs a lot of money to have healthcare. But I'm not being like, oh, I wish I was on Medicaid in a state that might take away my Medicaid because I could be poorer then or something.
Yeah, and like that thing about
it. 62. Sam, I guess the point I was trying to make at 62, when we were younger, we were full of hope that we could do better than our parents, and we could advance, and we could have a better quality of life than our parents did. And that worked for a really long time with the boomers. And then the boomers got to a point where, they could buy an extra house or whatever. And then we thought our kids were way more educated than us and way more successful. And they're not able to move up properly, except if you're in that really high bracket.
Well,
yeah,
yes.
most people our age can't even dream about owning a home. Like that was supposed to be the pillar of the American dream, and like a lot of us are just going to be renters for life. So
yeah, I mean, look,
So
the
let me
point
just
of
clean this
of
up.
a
So-
of a lack of mobility in this country, and the fact that kids are doing worse than their parents, without a doubt, you're a much more solid footing with that general point, Mindy.
Okay, so maybe let me just clean that up. I don't want any more hate. I don't want any hate tweets. I mean, and I don't want anybody to think.
Don't
you
hate
know,
tweet
I'm,
Mindy.
Like, out of
Yeah,
touch.
no hate tweets, please.
No, no hate tweets. I just want to say that it doesn't seem like it's moving in that direction where if you're not uber rich, you can get ahead.
Correct. I mean, this is a major problem in our society, frankly. And yes,
Like my son that lives in New York cannot buy a house anywhere within driving distance of her job.
yeah.
Like,
Yeah, well, that's also a problem in New York City, because you have basically like, a bunch of safety deposit box posing as apartments throughout Manhattan, and I imagine it, to some degree it's starting in Brooklyn too, and we need to do something about that from a housing perspective.
yeah, so that's what I was trying to say. So I know I sound out of touch because I'm 62. And I grew up differently than you guys did, but we could upper mobilize ourselves when we got educated and got married. We could do that. We could live the American dream.
I think that's why you're seeing so many young people have such issues with our government and with capitalism.
Right. Not only that, but like 2 of our kids don't even know if they want to have kids because they don't know if they can afford to have kids growing up, take care of kids. It's bad. It's just not the way it was. It's just their attitude. Like I understand their attitudes, and when we have discussions with them, they're just pissed off and not secure, and they're so educated and such good kids.
Yeah, I mean, I think it's kind of running up against, these are myths that this is about education or about like how you invest your housing capital. The affluence that you experienced was a result of a lot of major economic factors and state investment and like benefiting from the New Deal, right? And we're bound to be frustrated if we think we can do this by smart investing and educating ourselves out of this.
Exactly. Mindy, I appreciate the call.
They're trying to get rid of the middle. It's just as they're trying to get rid of the dream. It's really disheartening. I want it more for them, and it's just not. It's sad.
Hang in there, Mindy. Hang in there. Appreciate the call.
Mindy.
Oh, and Emma,
Yeah.
I did get your reference about Mean Girls. So
I mean,
gotta go.
90% of Americans got that reference, but not Sam, who's worked in comedy.
Mean Girls? That was not a movie when I worked in comedy.
It came out in the early 2000s.
I was not paying attention to movies like that at that time. Sexy Sam, sexy damn. Sam, you talentless Muppet. You look like a fava bean that came to life and then got fibromyalgia. So just said, F it. I love the show, but if I hear the word pivot one more time on your show, I think I'm going to have to call Mr. and Mrs. YouTube and get you shut down. All right. Fair enough. Rampaging Tower. After my second shot of Pfizer last week, I had some bad side effects the next day. But ibuprofen and a bong rip helped a lot. However, my symptoms were totally gone within 24 hours. Incidentally, I'm 23 and none of the older folks I have experienced any side effects. Blendu. Could the death of Prince Philip be the beginning of the death of the monarchy? I mean, I would imagine that like what happened with, those other two.
Try it.
Harry and Markle.
First name?
Meghan Markle.
Meghan Markle.
No, damn it. I wanted to hear him trying.
Was it Harry?
Yeah.
Harry and Markle.
I get that.
Sounds like a cartoon.
Because they've like taken themselves off the table, right? I mean, I think that's.
Yeah. I mean, who cares about Prince Philip dying? I guess it's just like he was 99
It was so
years
sudden,
old.
though. It was so sudden.
Right. I know. So unexpected.
Travis from Pittsburgh. My grandfather worked in a steel mill through the 70s when they started closing the mills. They said you have to change your shirt at lunch because it would be black from soot in the city. One of the other things that was that Gabriel Winant wrote in the book was the role of women in terms of like basically when people would come back from the steel mill, like they would do so much work to make sure that the guy had clothes and was like, you know, it's, you know, social reproductive theory, but like on steroids. Like they were, it was so dramatic that they felt like they were working for the company.
I mean, they were basically.
And they were. The change is amazing since then. Like your guest said, medicine is a huge industry, as well as banking, tech, and many companies coming out of Carnegie Mellon University. The universities themselves employ a large number of people. I think there are about 29 colleges in Allegheny County. Boston Baked Bob. Sam, you look like a desiccated fig. A few I asked if you could get Fran Lebowitz on. Is that going to happen? Well, is it punk? That's a good point. Brenda, will you write that down? Because I keep forgetting. Trilemma sounds like 3 Emmas. Kappa, says New Wrangler. Okay. David, my doctor uncle is an Obamacrat liberal. He runs a private practice serving most Medicare recipients and makes $500,000 a year. Sends his kids to expensive parochial schools, has luxury cars, and rent about $4,500 a month house in LA. One day I want to have a convo with him about nationalizing hospitals and private medical practices. I doubt he would support that idea, even though all of his earnings come from the government. Medicare for all is the compromise position. Yeah, well, that's why. He doesn't want any type of price controls on what he's making. Where I live and work, rents are cheaper than mortgages. That's backwards. All my city keeps building luxury housing. I think every major in the city should provide enough social housing for 30% of its population. Nuke this overpriced priced housing market. I agree with that. In New York now, like that dynamic is out of whack too, where like rents are lower than mortgage payments right now. Yet it doesn't seem to have any import on like where these house prices are going. And that's usually the sign, it's my understanding of a bubble. Like, and now I don't know what's creating that bubble. Maybe it's, you know, interest rates being, but I think there's a little bit of a bubble right now.
I mean, you see how the problem we have with homelessness and how many empty homes there are in this country. And it's clear that they're just sitting there as investments and people are trying to sell them higher.
Yeah. Or they're owned by banks that have foreclosed.
Right.
Like they're just stockpiling this stuff. I mean, who knows?
There should be just massive penalties on like homes staying on the market for, or being unoccupied for like, you know, a month or so.
Someone has proposed a tax, right? Like there should be
yeah,
like
California, I think 90 day
occupancy tax or something.
Yeah. I mean, it makes 100% of sense. I don't know what the societal benefit of keeping those things unoccupied so somebody can return investment.
And we just need more. We need to get back in the housing business as a government, not literally the business. You know what I mean? Jessica Favey, this interview is damn awesome. Thank you. Historiography. Illuminati kids, great interview today. Could have only improved if you had Pee-wee's Playhouse style alarm that goes off when a guest says zero sum. Hey, Mindy, your kids should pay their taxes and sell that house to someone who needs one. Unemployed Zoomer, fantastic interview today. What term would you, okay. Right. There's no inherent power. The term is like a decal you put on your car. It doesn't make it faster. Yes, I agree. Depressed Canadian. Hey, Sam, the argument about cancel culture isn't whether it exists. It's about whether you're fine with the left embracing the exact same tactics the left once denounced as neo-McCarthyism when it was used on leftists voicing dissent during the Bush years. Well, first off, there's a difference between neo-McCarthyism and somebody on Twitter organizing people to boycott you or to say you're bad. And then one is done by the government.
Yeah, McCarthyism was collaboration between like anti-communists in government and the CEOs of like Hollywood, for instance.
And are there specific instances, which I have a problem with? Yes. But like you say, the reason why I say there is no cancel culture is because that's been what is known as culture. And the only reason why it gets a special name now is because in some areas, the traditional people who had the power don't have that power anymore. In other areas, they still do. In other areas, they still do.
And it's often just the power of passing judgment, like people saying, like having reached a conclusion about a given subject. It's not canceling like white genocide theory.
If you're worried about people getting fired from their jobs, from their corporations, because the corporations don't like what they're doing, then the idea is we need better worker protections. Then your solution should not be people don't get criticized and people can't, criticize companies until they fire somebody. It's not a cultural issue. The issue there is that you have at-will employment. And if you want to create more protections for workers, I'm down with that. Let's start with you can't fire people and you cannot deny them housing if they're trans. Let's do that. I guess we have that protection theoretically, federally speaking now. But if you want to support stronger labor laws in this country that prevent people from being fired and at will fire, I'm down with that. It's not a cultural problem you're talking about. And if you're complaining that like people on Twitter get too much grief, give me a break. Don't be on Twitter. Just lurk. To say, excellent interview today. I grew up in Homestead. My dad was a steelworker. My mom was a nurse at Homestead ER until it closed in the 90s. Wow. That's your story. Chris from Taiwan. Emma, do you have a history of allergies? I have an EpiPen prescription and I'm getting my first jab on Sunday.
I mean, nothing that serious, just pollen and regular stuff. So
Libertarian.
I would not worry. It's all going to be okay.
Yes. Look,
what's scarier than a vaccination is a unknown until this year deadly viral infection called
without
COVID.
a doubt. Look, I mean, for me, like I was able to work through it. I didn't feel great, but getting sick and knowing that it's just like a finite 24-hour or 48-hour thing, and you know exactly what the cause of it is, to me, it's just like, whatever. Take the day off. You're hungover or something if you can. If you can't, try and schedule it on a Friday. Ibuprofen and Tylenol seem to work. I think men get it less than women, but that's just my anecdotal perception. But like
they're saying that the reports are that women 25 to 35 are having a harder time with the vaccine. But
I know women older who have had issues on that second Moderna.
Moderna?
Yep, many. And apparently like it's 65 to 70% of people get some form of like a side effect like that. But again, these side effects are not serious. I mean, they're just like literally like you feel like you got the flu for a day. Libertarian in recovery. Can't we just call it an infrastructure and jobs bill and be done with this annoying discussion of what infrastructure is? I guess.
Yeah. Hey, Sam.
Yeah.
Just so you know, Mean Girls is a critically acclaimed movie, and I just want you to know that.
I'll watch it. I'll watch it. Oh my gosh.
Yeah.
Oh, I watched King Kong versus Godzilla last night also.
How was that?
The B plot is just completely useless. But the fight scenes are amazing. I was surprised at how into it I was.
On your new TV,
Yeah,
that big TV, that's gonna look. I'm thinking about. It's on HBO Max, right?
exactly.
Oh yeah, I'm gonna do that on a weekend when I can indulge in some marijuana. Why be coy? It's legal here.
Wow, Emma, just like completely. There she is, folks.
Blaze it.
I tried to get my soundboard out for that. Let's go into some of these clips. Well, let's see. Maybe we'll take one more phone call and then we'll go to some clips here. Calling from a 617 area code. Who's this? Where are you calling from?
Hi, this is Lavinia from Brooklyn.
Lavinia from Brooklyn. What's on your mind?
I wanted to talk for a second about this whole cancel culture thing. It feels pretty obvious to me that this is like a big part of it is kind of a consequence of these big tech companies that use algorithms that prioritize, how do you say it, like high arousal emotions. And whenever people are like complaining about it, it's like when Fox News is complaining about cancel culture, it's like, yeah, I have a problem with big tech too. But it's not really that they're not letting Trump tweet. It's like more, how do I put it? It's more about like the fact that these companies have all made us insane.
You just don't like you have a complaint with social media.
Yeah, and just like the way that they want to keep you scrolling forever. So they prioritize like showing you posts that will upset you.
Yep.
You know?
Yep. I mean, I think look, we could regulate to the point where there's more transparency with algorithms. We could also, I mean, I for one, we should be breaking up these companies, and then I would regulate the hell out of them. And I would almost say like, you can't do I know like people like, well, I love my Netflix feed. It tells me what kind of stuff I want. Like, I don't know if you can have an algorithm that specifically targets social media users for stuff that they want to see. Like, I just don't, I have a problem with it. I think it's problematic. And
oh, definitely. I feel like sometimes I like notice the algorithm serving me something, and it's like from the darkest, most evil component of my personality. And I'm like, I don't want this amplified at all. Like, please don't give me this. But they give me more of that because they know that that part of me is also like the most profitable in some way.
Well, let's put it this way. Let's do it this way so that, people can understand my position. And I think, obviously free speech advocates would have an issue with me telling a corporation that you cannot use algorithms to serve up stuff. And I would rather not pick which kind of algorithms people can serve up. But I think so I would probably just get rid of all of them, frankly. I mean, I don't know. But would we be okay as a society with an algorithm that could establish that you have a propensity to gamble, a very high propensity to gamble, and you were sent constant ads or posts dealing with gambling? Would we be, as a society, comfortable with an algorithm that also knew that based upon your buying purchases when your paycheck comes, because they bought the data from somebody else? And so we're going to feed this stuff to you right on the day that your paycheck comes.
Right,
I mean,
exactly.
like I don't think we would. I don't think people would have trouble finding broadly speaking, like I say, free speech absolutists would say, like, you cannot impinge upon the First Amendment rights of this company to do that. I don't feel that way. I think we can, the government can heavily regulate that stuff. And, we have certainly a precedent. And so in addition to, antitrust, I would have strong regulation of this stuff and really take a lot of these issues off the table.
Yeah,
chronological
I think
timeline.
also,
Let's go back.
As far as like whether or not it's speech or something, Like an algorithm is a very broad word that means everything. Like an Excel spreadsheet has algorithms in it.
Yeah.
But the more specific term for it is like machine learning, and these like neural networks that can kind of build a mirror of your psyche. And I think like we need more government literacy. Like there needs to be an office in the government or an agency of people who actually understand this stuff, because God knows a senator or a congressperson,
Yep.
like they don't get how this stuff works.
No, absolutely right. In fact, I did an interview with, I am trying to remember her name now. She is she writes artificial intelligence. She's from MIT. She writes about artificial intelligence, and I'm trying to remember her name. I think it was Karen Howe. I think it was. Let me see. And she has a really important piece that we will ultimately play. Yeah, it was Karen Howe. She's at the MIT Technology Review. And she did an amazing piece about Facebook. And they have multiple AI teams. And it is worth a read of that article. You can find that interview on the Peacock app. At one point, it will make it to this audience, but it talks about basically like, and they have like a sort of a secret AI team that one that sort of is for the public, and the others that are actually sort of driving stuff. And it's a problem. Appreciate your call.
That's so dark.
It's dark.
Thanks so much for picking up. Yeah, love you guys.
Thanks
Have
for
a
the
great
call.
day. Bye.
Like how she's tried to sneak in there with a 617 area code. I think I'm picking up somebody from Massachusetts. She slips right in like that. All right.
And she's in Brooklyn, so she's kind of your mirror.
Yeah, I was going for the Massachusetts call, but whatever.
Well,
971 area code. Who's this? Where are you calling from?
Crinklin's
971
rappers.
Hi, this is 971, Evan from Portland.
Evan from Portland. What are you writing, Evan?
I am working, but I'm off work now.
Oh, you're working. All right. Well, what's on your mind?
So I wanted to talk briefly about union healthcare and how good these benefits really are. I'm in a great union job working for a large university, and excuse me, the healthcare is actually quite terrible. The monthly payments are not bad, but I've been fortunate to have some chronic conditions, and I spend probably $10,000 a year.
Oh, jeez.
So the myth of union healthcare is that it's a myth. It's better than American healthcare in general, but it is terrible.
I mean, I think there are probably some unions that have better healthcare, but by and large, I mean, the healthcare system sucks. And so it's pretty rare to get like good healthcare within it, regardless of where it's come from. I have no doubt there are some unions that have really good healthcare, but it's still right. Like you take their healthcare, right? You take the union healthcare as opposed to like some other one that you know, I don't know that you would even be eligible though to buy it on the exchanges at this point. And so unions still see it as something that they're offering, that's an offer on their part. And that's going to be tough to get around that.
Yeah, and it is. And you know, the management comes back each year and tries to cut into it. And the union has to make concessions in order to keep the terrible healthcare that we have.
Well, I appreciate the call about that. Good point.
Yeah. Yeah.
Thank you.
This is a good exchange between Mehdi Hassan and Anthony Fauci on, I guess it was on Mehdi's MSNBC show last night. Well, let's play this because I still don't know if it answers the, you know, sort of like the primary question, but go ahead. No sound. Sorry about that. Let's try that again. No sound.
Still no sound.
It says it's working on my end, but I don't know. It must be something.
Let's try. Third time's a charm. And indeed, it is not a charm. All right, we will get to that another time. Should we try a different one to see if it's a problem with that?
Brendan says he's going to rejoin.
Okay, Brendan will rejoin in a moment. Let's take some more IMs in that instance. Gigi Palin, I might have missed your comment on it, but thoughts on how Lasso managed to win in Ecuador? A sad surprise to say the least. Yeah, this guy's a banker. I don't know what happened in Ecuador, to be honest with you. I'm surprised by it. I don't know Ecuadorian politics well enough to make that kind of assessment. Maybe it's a COVID thing. I don't know.
Yeah, it's disappointing. I don't know off the top either, but we'll probably talk about it on Left Reckoning on Thursday night.
Noogs. Hey, Sam and crew, was just at the counter protest against White Lives Matter and KKK this weekend in Huntington Beach, California, rocking my best left is best gear and MR mask, which always gets compliments, whether at protests or just at grocery stores. Nice. Like it.
I heard one in Fargo got swamped, or at least some of the people didn't show up because there were more counter protesters than white supremacists.
Awesome. All right, let's go to
the one in Huntington Beach. I think. There was anyway. That made a lot of news. There was an assault that I don't think we could probably show on the stream of an Asian protester.
Oh, really?
Or counter protester. I believe so.
Eesh. All right, let's play this clip of Anthony Fauci on Mehdi Hassan's show. And I still am not satisfied necessarily with this answer. Here, turn this.
I'll try to.
You said we need to move forward. I agree with you. And one of the problems we have now is we have a lot of people, bad faith people, saying we don't trust Anthony Fauci, we don't trust Joe Biden, we don't trust the science.
Oh, what happened? It was working.
Just genuinely over the last year, and I think you've recognized this in the past about the mixed messaging and some of the different advice they've gotten on this very thorny disease. I want to play a clip of you speaking to 60 Minutes just over a year ago. Have a listen.
Now, when you see people and look at the films in China and South Korea, whatever, everybody's wearing a mask. Right now in the United States, people should not be walking around with masks. Right now, people should not be walking. There's no reason to be walking around with a mask.
Given you acknowledged in that clip in March 2020 that Asian countries were masking up at the time, saying we shouldn't mask up as well was a mistake, wasn't it? A huge mistake at the time, not just in hindsight.
No, I keep seeing that clip getting played over and over again. So if you could give me 15 seconds, I'll go right back at you with this. Okay, at the time, three things were going on. We were told very clearly at the Coronavirus Task Force, including by the Surgeon General, who's a good person all the way, that there was a clear shortage of masks. And if we went around recommending masks, the healthcare providers who were putting themselves in harm's way every single day would not have enough. Point number one. Point number two, there was no evidence at the time that masks outside of the setting of the hospital worked. There were no data to show that. Number three, we did not know that at least 50% of the infections were being spread asymptomatically, namely by people that had no symptoms. That's the reason why, at that time, I and others made that statement. Fast forward a month or two after, it became clear there was no shortage of masks. In fact, cloth mask works. B, we started to see rather substantial data that masks outside of the setting of the hospital work to prevent infection and to prevent you from infecting somebody else. And three, we found out to our horror that 50% or more of the infections were transmitted by people who did not know they were infected.
Yes.
That's the reason why I changed. So, wait, let me just finish, because you showed the clip. First of all, if something is static and you change your mind about it, you're flip-flopping. If something changes, the data change, and you change with the data and rely on the data, you're not flip-flopping, okay?
I mean, this represents both, like, I think his explanation perfectly legitimate, right? Perfectly legitimate, but it also represents a massive failure societally wide, really actually with the West, just broadly speaking, because the problem that you have with a pandemic is that you need to close the doors of the barn before the cows get out. And sometimes, and the problem is that we didn't have an ability in our society, and I think this is true across the West, to sort of like take this seriously enough to do stuff that maybe seem like the idea that we would do anything that would be in an abundance of caution, that would in any way implicate our way of life, which is to walk around without a mask, was considered like completely, you can't do it. And that's why we had this problem. And largely speaking, the Far East and the Pacific Rim area, that part of the world did not, is because they responded immediately.
Well, they had experience in the way that countries like the United States had not had experience. And so, it's a complicated analysis looking at this. I mean, so I understand Fauci's explanation, but the reality is that, because of the shortage of masks, he was downplaying really the effectiveness of masks. I mean, he kind of says that they didn't know, but come on. I mean, he's an epidemiologist who's been dealing with these diseases for years and years. Of course, they would understand that masks would prevent the spread. They just didn't want there to be a run on them. And so he lied. I mean, that's, I think, the true
I think
core
that's
of it.
part of it. I think they could have come out and said, use cloth masks, and been worried about, like, use a t-shirt, and be worried about the idea that, that people would start using, like, surgical masks and et cetera, et cetera. I don't think they realized it was aerial-sized. I mean, part of this is just like our government did not did not have the mechanisms in place to deal with this as quickly as they did. And part of it was also that administration refused to take it seriously. And so we did not have that data about it being aerial-sized. I'm not saying that correctly, but, as an aerosolized. I mean, I distinctly remember, passing around a video. It must have been like probably March 20th. I mean, the first week or so, from a doctor in New York City who was being very explicit about, you don't have to worry when the delivery guy shows up. The whole idea is don't touch your mouth, don't touch your eyes. It was all about touch. It wasn't until, I think we had,
I mean, we were wiping down our packages. I was going, I remember when we declared a national emergency, I was like running from CVS to Rite Aid throughout the city because everything was over, like just with rubber gloves on. Right.
Right. And we had a couple of epidemiologists on, I think Mark Alain Derry and Osterholm on Osterholm on, and both of them, but that wasn't until about April, said air, that it's not about touch. And so it took a while, but I think like there's a bigger failure that goes beyond that. It is a dispositional failure that we had, which is better to be overly cautious early on, particularly with something like this, than to have to worry about it after the fact. And on some level, as a country, we still haven't learned this.
Well, of course, yeah, and so but Fauci is, in his guidelines subsequently, was in some ways, trying to get people to be overly cautious and so then before that, he was like erring on the side of not as much caution. That doesn't seem consistent to me. It seems like a calculated
You
PR
learn.
lie.
You learn. I mean,
he's been doing this for decades.
He's never lived through a pandemic.
I'm sure, given his expertise, he was well aware of SARS and what that did in
epidemics
in Asia.
Yes,
understand. But to me, I'm not saying Fauci's a bad actor.
I agree.
I think that as a representative of the United States government, he lied to the public in order to prioritize healthcare workers so they could get a grasp on what was happening. It seemed obvious, based on the information that they probably had, that like masks, at least as a preventative measure, would have been a good idea.
Yes. But my point is that we have a society where taking preventative measures is, right? Look, it's a preventative measure to have 10% extra capacity in your public hospital system. It's going to waste money, but it's a preventative measure. We as a society just don't place, it's basically, on-demand supply type of situation. We don't build any stockpiles.
Yeah, and my point, though, is that Fauci...
Like masks, for instance. Like if we had a legitimate supply of masks in this country, that it doesn't matter if there's a run on N95 masks by the public, because we've got 60 million of them, and we're going to send them all to hospitals and to first responders.
And I think, there's a reason he listed that as the first reason in that. And I think the other important thing about this whole Fauci lie thing is it is just a stab in the back myth on the right now. And they love it. They love that Fauci had that misguidance in the beginning so they can just disregard everything else. So that's the main function it serves now.
Yeah, I totally agree with the function of it and why. I don't know if I would have even, if I was Mehdi, asked that kind of question, just because of the implications of it for people who want to, be COVID deniers in other ways. But I'm just in terms of the more nuanced conversation that we're having, I think, that was more calculated maybe than we of course realized at the time, but then maybe Fauci is presenting.
This is fascinating. It is about time we've heard of investigating the investigators. Isn't that Durham investigation still going on? Is that Durham investigation going on? It's like now 2.5 times the length of the investigation. You don't hear much about that. That's sort of weird. We don't hear about that Durham investigation. All the people who were worried about the waste that was involved in the Mueller investigation. Nevertheless, this notion of investigating the investigators is catching a little bit of it's catching on fire. It's spreading. People are interested in it. Here is Mike Lindell on Steve Bannon's show, and not only is this guy interested in what's getting on with the real truth, and he's been canceled. I want to hear more about defense of him, because if you're against cancel culture, you should have a problem with Mike Lindell. He's not selling his products. Like a lot of chain stores are saying, I'm not doing MyPillow anymore. Yeah. They won't even let this guy on, never mind on Fox. I don't even think they'll let him on One American Network anymore.
Nope. But the one guy, the true hero who isn't canceling him is
Steve Bannon. Let's hear what Mike Lindell has to say.
1,500. Why are the Murdochs, and correct me if I'm wrong, I think you're one of the biggest advertisers over there. I don't remember seeing you on Fox recently. Why are the Murdochs afraid of Dominion? Is it something about their cases, something about the facts? The Murdochs are tough. They don't care.
The lawsuit, probably.
So why is Mike Lindell not on Fox? And why do they seem to say, hey, when Dominion says something, we're just going to shut up about it and talk about Biden's tax bill?
Well, I'm going to have those answers too, because I've hired private investigators and I've spent a lot of money on them to investigate everything. why are the bots and trolls? Who's behind them? Well, why is Facebook involved? Wikipedia involved? And then the big question: why isn't Fox having people
Wikipedia
on?
gate.
Why isn't Fox on there talking about Dominion and Smartmatic and the election fraud? Why don't you get on there and talk about things you don't like about the vaccine?
But hang on, what if their response is, "Hey, Mike, we saw the films, we've seen it, and we just don't think you got the evidence"? What if that's the? I mean, have you talked? Have you guys reached out to those guys and said, "Hey, why don't you have anybody on it?" Their response may be, "Hey, I hear you, I love you, I love the ads, but I'm just not seeing as far as the evidence goes." Could that possibly be a response?
100% no. When we came out,
Oh
It
my
couldn't
God.
be. It couldn't be.
Oh my God. No way. No way.
What does Wikipedia have to do with this?
You haven't heard about Wikipedia Gate?
No, I'm sorry. I guess I'm misinformed or uninformed.
I don't know.
Yeah.
I have no idea. This guy's such a lunatic. And first off, if I was, his family, I would be a little bit concerned about people randomly trying to reach out to him and scamming him about information.
Yeah.
For money.
I would love to be a private investigator billing him for service.
That's what I'm saying.
Absolutely. And
I have got some secret stuff I've got to tell you, but I can only,
you can only unlock it with a couple more thousands of dollars.
I got a secret. I got to follow a lead down to Cancun. So I'll be right back.
Yeah. He's hiring private investigators to see who's changing his Wikipedia page.
Do we know what's happening with that Sidney Powell lawsuit? I mean, is that still ongoing?
I'm not sure, but speaking of this situation, he doesn't entertain that the lawsuits might be the exact reason
They're being sued for like
they aren't.
$1.6 billion, is it?
Yes. I mean, that seems to be conveniently left out of his analysis of why they're not covering his documentary, right?
That's just chump change relative to the MyPillow guy. $1.6 billion. Who cares?
What is Steve Bannon's liability in this? Because he keeps having Mike Lindell on, but he'll very carefully tamp down.
I wonder if he's just sort of dabbling on the edges there.
He really is. He's walking a tightrope.
But that's Bannon for you.
I mean, he's already banned from most platforms. He's on his own website now, and he needs to keep in good with all those crazes that Lindell is really speaking to these months.
Yeah, I know. It's in terms of, given the fact that he's been deplatformed, I'm sure he's not raking in as much money, and he might want to be careful regarding Dominion lawsuits.
Let's play this clip of Jimmy Dore. He went on Tucker Carlson's show. Now, this is not, I just want to be clear. This is not the clip of Greenwald going on Tucker Carlson or Greenwald going on Jimmy Dore. This is Jimmy Dore going on Tucker. Like this whole like sort of circle jerk that has been created with this sort of like corner of the internet and Fox. It's very similar to what we used to see with, Shapiro, that bald guy from the Daily Wire. I can't remember his name. And the IDW folk and the other guy who's the actor who's not that who's demo real. What's that guy's name? The Daily Wire.
Yeah.
I can't.
Matt Walsh.
No.
Knowles. Michael Knowles.
Mike Knowles. Right. Like this is what they do. This is a very explicit strategy. And that is, we're going to continue to go on each other's shows and and basically we're self-dealing on some level. It hits.
Well, Tucker's not going on Jimmy's show.
Well, Tucker's not going on Jimmy's show, but Tucker ultimately may go on one of these shows. But yes,
well, it's a Jimmy goes on, bolsters Tucker's anti-AOC in this case is talking points, and he gets attention. He doesn't challenge him.
It's more than that. what happens like when all of these guys start doing each other's shows and reinforcing and rush in when there's a Twitter effect? What it does is starts to close a sealed hermetic bubble where they are not subject to any type of criticism. Whenever we give criticism to, let's say Greenwald, it becomes like I'm a little hunchback, snivelly little guy who's, whatever, banal or whatever.
The most hunchback,
Whatever.
because
The most hunchback, banal.
all of
But whatever it is.
Greenwald's attacks are hyperbolic.
There's no, and they seem personal. There's no air that gets into that bubble, right? Like you saw the way that Jimmy cut up that video of, the filmmaker who came on, and we only saw it. In fact, he wasn't even going to release it. And it was only because the filmmaker himself shot a video of the interview. And that's somebody who was a fan of Jimmy's, who was like, supportive of Jimmy. And so they protect themselves from any type of criticism, but they elevate themselves by going on each other's shows. We saw that on the right, and we're seeing it now in whatever these guys call themselves here.
Jimmy's effort to make the Red-Brown Alliance an actual thing.
Yeah, I mean, this notion of anti-establishmentarianism. Like, I mean, if we had a socialist government, would they still be anti-establishment? Like, I mean, this is really, there really is the question, right? Like, maybe they would, maybe they wouldn't. I just like, that is not necessarily an ideology, right? Like, you can learn that just watching.
Yeah, roping Tucker in is different. Tucker is like cloaks himself in anti-establishment rhetoric in order to push far right white supremacist agenda, and Jimmy enables it. Yeah. The idea that Tucker Carlson,
who attended a private school, attended a private college, who is an heir to a millionaire, if not billionaire fortune, works for billionaires and is himself a multi-millionaire. The idea that he's part of the establishment, give me a break. Of course he's not. This is not part of the elite. Tucker Carlson's just out there on his own with virtually no support except for that massive network behind him. But here is Tucker and Jimmy Dore, and they are talking about, there was somebody who had tweeted something about AOC. And then they quickly said that they had gotten approached by, or they got like a knock on their door from somebody from the California Highway Patrol. And it's unclear how confirmed it is about the post that they said it was about AOC, but it was a fairly tame post criticizing AOC for, sort of being a little bit dodgy and on her response to a question that was, about Israel and Palestine. Her response wasn't great by any stretch of the means. And this person tweet was just like, this is a dubious response by AOC. That was about it. And this person claims that it was that tweet. I don't know that we have confirmation that it was about that tweet. We do have confirmation that came from Ryan Grimm that somebody from the California Highway Patrol had come and visit this person. And then the question was like, who called the Highway Patrol? So the question was it the Capitol Police? And if so, who called the Capitol Police? And Ryan Grimm called AOC's office. They said, we did not call the Capitol Police. Ultimately, he reached the Capitol Police. The Capitol Police said they did not call us, but we're not giving you any more information. And it's sort of unclear now where it is, who called the California Highway Patrol and exactly what they were responding to, what tweet they were responding to. So we're going to take it, the faith of the person who got called that it was about this tweet or it had to do with AOC. But we don't know who tipped them off here. But the desperation to use this as an attack on AOC is palpable. Look, just like when the DHS went to we had him on, I can't remember his name now, Feral Jokes on Twitter. Do you guys remember his name? I can't remember.
Nick Flores.
Nick Flores. Yeah, when Flores was on, when DHS went, this is wrong, and they need to get to the bottom of this. We need to figure out why. But the idea that even after AOC and the Capitol Police have confirmed that it was not a function of her, why is this still a story about AOC and not about the highway patrol? Well, because there is an agenda that folks like Jimmy have.
And Tucker, for that matter.
Of course.
Speaking for myself, I'll be honest, I love seeing it. I like it when young people come up and seem to believe in something and win. I mean, I don't agree with her, but I like that.
He's talking about how he loves that, the first part of the segment, which we're not playing, Tucker is saying how he loves that AOC came up believing in something. He doesn't agree with it, but he loves that she had a youthful energy behind her. Was that in keeping with his commentary at the time? I'm not sure. Maybe we could roll the tape, but continue.
Well, he has to be just as disappointed in her as his guest.
As Jimmy, right. Well, they're two peas in the pod these days.
Like it when young people come up and seem to believe in something and win. I mean, I don't agree with her, but I like that. And then she immediately winds up on the side of the biggest and most powerful companies in the world.
Oh, yes.
Like, this is like the end of Animal
Tell
Farm.
it to
It didn't
Amazon.
take long for her to switch sides, did it?
It's happening right in front of our faces, and there's people who don't want to see what's happening. And I've been the one out in front on the left telling people what's happening, that you don't change the Democratic Party, Tucker, the Democratic Party changes you. And so that's what we're witnessing. And so for her to say that I was committing violence by using words to criticize her, I don't know if you've ever been hit with an adjective.
Did she say that?
I'll take that over a bat or something. But, I don't know if I got hit in the head with a noun the other day. I had to go through the concussion protocol. I'd rather be hit with words.
Pause it. So is he saying that words cannot constitute violence? First off, let's be clear on what he did here. He started yelling that she's an effing sellout. She has betrayed you. She is an effing fraud. Yelling this. If I say that Jimmy Dore is an effing fraud, and I start saying like, this guy is betraying you, that he's sitting there in his luxury home and he's betraying you and he's just doing it for cash, and that starts to inspire people to threaten Jimmy Dore. Is what I'm doing just like not inciting violence at all? I mean, it's absurd. Why don't they roll the clip of what Jimmy said on that show? You know why they don't? Because they can't. They can't. They'd have to block it out. They'd have to beep it.
Yeah. Did AOC ever
run the clip that Jimmy Dore is referencing there? They would never run that clip.
Did AOC ever? Well, one, because it would make him look like the unhinged lunatic that he is. But also, did AOC ever acknowledge Jimmy? Like, what is he extrapolating that
specifically?
She didn't.
No, of course not. But I mean,
no, but yeah,
Jimmy's incapable of not perceiving,
but making it about himself. So he gets to he gets to cosplay as aggrieved and as the person who's being targeted by Ocasio-Cortez, even though she never addressed him specifically. I mean, why would she stoop to acknowledging that? So it's like, I don't know if there's more to that, but
let's play more of this clip.
Yeah.
The other day, I had to go through the concussion protocol. I'd rather be hit with words than actual violence. Okay, because you know what's going on is that the working people in this country are on a ledge right now, and the establishment doesn't care if they fall over. And so they're using crude forms of censorship. We've seen it. We see what they wouldn't allow the Hunter Biden story to get out. And so there's way worse things are happening. So this is a chilling time right now for people like me. It's chilling when the powerful want to insulate themselves from criticism. AOC said that if you criticize Joe Biden and his administration, what message does that send to black and brown people? Well, the message I think that sends is that we're willing to stand up for black and brown people, even during a Democratic administration that is letting them down, gaslighting them, and not giving them COVID relief. That's what that means. She thinks what she's doing is using identity politics to shield them from real criticism.
Pause it. Okay, or I don't know.
Exactly right. And
Okay, it's exactly right. You can keep going. I don't know.
keep going. Oh, I just love. I would love to know Tucker's inner monologue here. Oh, this is perfect.
Oh, that's exactly what I need.
So good.
That's exactly right. And I should point out to our viewers who may not understand this, that you make your living on these big platforms, on YouTube, for example. And for you to come out and say what you've said about them takes a lot of courage, I think. And I'm impressed that you're willing to do that. Too few are. Jimmy Dore, thank you.
Jimmy Dore, thank you.
This dude, when the story about radicalization that takes place on YouTube came out, right? I mean, you remember that story and it was about that guy, Caleb
Kane.
Kane was the subject of it. That story came out about how the algorithms took him down this portal and it turned him right wing. Jimmy Dore was out there defending YouTube so dramatically, when of course any idiot could see, like, of course, YouTube is incredibly destructive, without a doubt, 100%. I'm on YouTube right now. Incredibly destructive. I just said, I advocate constantly, get rid of the algorithm, which is their fundamental mechanism in which to make money.
So brave.
I'm so brave. I'm so brave. Oh God, I'm so brave. I should go on TV and brag about how
Tucker should invite you. Tucker should invite you, Sam, for being so goddamn brave. And then notice when he talks about the establishment. By the way, just like so lazy. It's like he doesn't even have his talking points down. It's just retreading it from 2014 or 2000, whatever. Like that. Like he picks the Hunter Biden story.
Completely.
He could have used that opportunity to talk to Tucker's audience about Medicare for all. Look at how many countries don't provide health care for their citizens, and this is how the establishment's screwing you. Or college education accessibility, free college for all. The fact that we have corruption in our government. The fact that we should be raising the minimum wage from a starvation wage to a living one. He didn't do any of that. He decided to pull out of his ass Hunter Biden, and that's how you know that Jimmy is adjusting, and well, this is who he's becoming now, but his exact talking points in order to appeal to Tucker Carlson, because he wants those sweet appearances.
Exactly.
Now who's the one who's selling out?
Exactly. And remember, now Jimmy grew up in a blue collar household, just like Ken Langone. And just like Ken Langone, he's not a worker anymore. He's not blue collar. And despite the fact that he is a champion for the working man, and he is a champion, of course, for black and brown people in a way that AOC could never be, because Jimmy has been for years making money on YouTube and helping black and brown people in that way every single day of the year. I mean, give me a break. The game is so obvious now, and Emma just like nailed it. You know, like, it's one thing to go on that show and and argue with Tucker Carlson, or to make some type of like argument that I'm secretly dropping in left-wing perspective on that show. But I'm sorry, that's not happening. That's not happening. Oh, geez. Oh yeah, we got to get going. Okay.
I know. I didn't want to cut you off, but
that's the bottom line. I mean, give me a break. It's a joke. And then there is just these group of people who I think they find it in their business interest to grow this in this way, and this is what the game they're going to be playing. So
I would just say also to the left that thought AOC was actually sending cops to people's homes over that tweet. Maybe you should prune some of who you're following that really was amplifying that particular interpretation before waiting for any sort of facts on the ground, because that was insane.
I didn't see that in my timeline at all. And so there you go.
I can't help myself. All right, folks, we're not going to have time for any more calls. Apologies. Sorry. We had a lot of people hanging on for a long time. Let's go to the IMs. Chardonnay. Hey, kids, don't forget to smash that like button. Okay. Jay from CA. Awa. Nerd Cheetah, is your intent spreading the common sense of adopting the posture of surrender to the lesser of evil because it's bound to be simply less painful for everybody of the greater evil? Is that the new pragmatic reverse incrementalism? I don't understand what that is. Country Mouse Tech, is it the height of irony that Google beat Oracle in the Supreme Court with a fair use defense, or is it the highest possible irony? I got to look into that more. Sammy Key, Sam discussing oral hygiene on a date. Everyone's inner Michael is crying. JJ Cool, hey Sam, I agree with your position on taxonomy. That said, when it comes to the Bernie campaign, don't you think it was oh yeah, we already read that one. Train Iraq, housing bubble, time to talk to Dean Baker. Yeah, I want to check on that. I'm starting to wonder about that rent to cost ratio. Ellie, I pay $12,000 per year in health insurance premiums. I have to pay $6,200 out of pocket before the insurance pays. I buy on the exchange because I'm self-employed. It is supposedly healthcare shouldn't cost you, or health insurance shouldn't cost you more than 8%, but that copay and deductible, I think, is where they get you to. Panda, on a scale of 1 to 10, how would you rate the House Progressive Caucus in effectiveness in this Congress?
Ask when we know what happens to filibuster.
I mean, I need to. I mean, in the House, I don't think it's there yet. Their effectiveness, I really don't. There may be one or two things that we can't quite see that were in there, but
marginal maybe be a good word to say.
But I would say 4 or 5 at this point. We'll see. I think it's going to get better. Jimmy Dorable, people who earn over $250K are in the top 6% of earners.
And you gotta be quick.
Smuzz, are you kidding me? Mindy, 150 is upper middle class. Yes. Okay. All right. I'm going to take 3 more and then we'll get out of here. I'm going to skip ahead. Chris Burdick, at least My Pillow guy provides a product. The only product Jimmy Dore is selling is Jimmy Dore, and it's defective. That's a good one. Jude from Connecticut, Capitol Police confirmed that it wasn't AOC's office. They did go to the person's home, but it was because of a tweet and that person's replies. The Capitol Police screwed the whole thing up. This is piecing together from what Queer Al Lamone's own Twitter account, Ryan and other accounts covered it. All right. So there you go. It wasn't from that initial tweet. It was something else. And the final IM of the day. Shoot, I can't find this now. I'm out of practice. John McDropout. Is anyone going to suggest that Dr. Fauci overseeing both the AIDS crisis and the COVID pandemic response might make him at least partially responsible for those obvious failures? I mean, I don't know what time he came on the AIDS crisis, but if it was during Reagan's era, I mean, Reagan, I just don't know if he had the authority, but something to dig into. All right, folks, see you tomorrow. Good job, Matt, Brendan, and Emma.
It might take all the strength I got to get to where I want, but I know somehow I'm gonna get there. I wasn't looking when I just got caught between the truth and the lie bar. But finding out won't make me feel any better. Yeah, I know the clock is ticking, but the meds are gonna kick in.